25 symptoms of acute abdominal pain in movements, passing gas, vomiting, diarrhea, constipation, fever, persistent crying, burping, colic, persistent crying without apparent cause, dizziness, irritability, and restlessness, with difficulty in settling down or being comforted, distended abdomen, refusal to feed, decreased appetite or feeding interruptions, vomiting, diarrhea, constipation, fever. Acute abdominal pain in infants can be challenging to assess due to their limited ability to communicate. Symptoms may vary widely depending on the underlying cause. Here are key indicators and possible associated conditions: general symptoms, crying and irritability, persistent or intense crying can be a sign of discomfort or pain. An infant may cry more than usual or have a high-pitched, inconsolable cry. Facial expressions, grimacing, wincing, or a pained expression when touched or moved. Physical posturing, pulling legs up toward the abdomen, arching the back, or assuming a fetal position can indicate abdominal discomfort. Associated symptoms, vomiting may range from mild spit-ups to the first go vomiting depending on the cause, diarrhea or constipation, challenges in bowel movements, presence of blood or mucus in the stool, feeding difficulties, refusal to eat, fuzziness during feeds or vomiting after eating. Fever may be present, indicating an infectious cause, distended abdomen, swelling or bloating of the belly, lethargy, reduced cat activity level, seeming unusually sleepy or unresponsiveness. Common causes and specific signs: intussusception, sudden onset of severe intermittent abdominal pain, current jelly, stools, blood and mucus, a palpable mass in the abdomen, volvulus malrotation, sudden severe pain, vomiting which may be bilious, green acute gastroenteritis, diarrhea, possibly with vomiting, fever, dehydration, incarcerated hernia, a bulge in the groin or umbilical area that is painful and cannot be pushed back in, urinary tract infection, fever without clear cause, fuzziness, vomiting, feeding difficulties, necrotizing enterocolitis, primarily in preterm infants, distended, tender abdomen, bloody stool, lethargy. Diagnostic approach: physical examination looking for signs of distended masses and hernia. Laboratory tests: blood test for infections, stool test for bloodborne infection, urine test for UTI, imaging ultrasound for intussusception or volvulus, X-rays for intestinal obstructions, gas patterns, treatment based on the underlying cause, ranging from surgical intervention for intussusception, volvulus, to medical management, antibiotic for UTI, rehydration for gastroenteritis. High points: acute abdominal pain in infants require prompt evaluation to rule out life-threatening conditions like intussusception or volvulus. Key signs include inconsolable crying, vomiting, abdominal stools, fever, and changes in feeding patterns. The physical examination and appropriate imaging are crucial in diagnosing the underlying cause. Treatment is cause-specific, with some conditions requiring urgent surgical intervention. So let's sum up. Symptoms of acute abdomen pancreatitis. Abdomen symptoms cause acute abdominal pain in infants, passing gas, vomiting, diarrhea, constipation, fever, persistent crying, burping, colic, persistent crying without apparent cause, fuzziness, irritability, and restlessness, with difficulty in settling down or being comforted, distended abdomen, refusal to feed, decreased appetite or feeding interruption, vomiting, diarrhea, constipation, fever, crying and irritability, facial expressions, physical posturing, vomiting, diarrhea or constipation, feeding difficulties, fever, distended abdomen, lethargy, intussusception, current jelly stools, palpable mass in the abdomen, volvulus malrotation, sudden severe pain, vomiting, bilious, green, acute gastroenteritis, diarrhea, vomiting, fever, dehydration, incarcerated hernia, bulge in the groin, urinary tract infection, fever without clear cause, fuzziness, vomiting, feeding difficulties, necrotizing enterocolitis, preterm infants, distended tender abdomen, bloody stool, lethargy, physical examination, laboratory tests, imaging, treatment based on underlying cause, surgical intervention. A prompt evaluation, key sign, crying, vomiting, abdominal stool, fever, feeding patterns. Amen. How specific or the difficult intervention.